We'll go ahead and get started. Welcome everyone. My name is Amy Elliott. I'm the training coordinator for the Montana Public Health Training Center. I am joined with Matt Kelly, who will be leading the webinar today as well as next week on communications with elected officials, specifically to Montana, but this can be anywhere else across the country as well. As always, I will be here throughout the entire training, letting people in, managing the chat box, being on the backside of the technical part. If you have any questions, please don't hesitate to ask. I'll be more than happy to help you out. Emily Weiler will be joining us hopefully in a little bit after a meeting, so she'll be here as well. If you get kicked out for any reason, again, feel free to jump on at any time. I will let you guys in. And with that, I will pass it on to Matt. Let me end my slideshow. 1 second. Okay.
All right, thank you, Amy. I appreciate your help and backup on this. It's always helpful to have a second hand and second set of eyes watching over things. So I also appreciate everybody who is out there and taking the time to do this today. I hope I can live up to your expectations and your needs. Just a little bit about me. I'm going to go through, and then I'll go through what the class will look like both this week and next week. A little bit about me. My name is Matt Kelly. I'm the CEO of the Montana Public Health Institute. I've been in that job since July of 2021. The Public Health Institute is a relatively young organization. We were founded in 2020 as a nonprofit 501c3 that our work is really to help make the entire public health system work better, to be that connective tissue between some of the really great assets that we have in our public health system, including local health departments, state health department, the University of Montana Public Health Training Center, for that matter. So one of the things that we were working on after the legislative session in 2021 is really trying to get our minds around what happened in that session and how local health departments could adjust to that. And so today, we're going to talk about engaging policymakers. I'm going to spend some significant time at the outset of today's class, the first really half of today's class, really talking about Montana's system of government, state government, and how that factors into local government, as well, and maybe even more importantly, how the public health system fits into that system of government. Because if you don't have that foundation, it's very difficult to engage policymakers as effectively as you can if you do have that basic information. I beg forgiveness. Some of you may know this already. I see some of you who have been in the public health practice for quite some time. Some of this may be reviewed, but I think it's worth moving through. What I'm going to do now is share my screen. Well, before I start, I'm just wondering, by a show of hands, just so I can get a sense, how many of you out there, and if you can use your, what do we call them on Zoom, your reactions keys, a hand raise or some sort of emoji, how many of you work for a local health department? Can you show me? All right, and then can you put your hands down? How many of you work for the state health department? Okay, put your hands down. And how many of you work for other organizations, other types of? Okay, Jude, you want to let us know like who you? And then the only reason I'm asking is just so I can kind of get a sense of who the audience is here and how I might shape the next class even.
Yep, my name is Jude Werge. So I'm the emergency preparedness coordinator for Livingston Healthcare.
Okay, great. Thank you. Welcome. Lace, where are you from?
I'm from the Eastern Montana. I'm AmeriCorps, helping out with Dawson.
Oh, welcome. I'm glad to have you here.
Thank you.
Okay. The other thing I would say before we start, I'm going to go through some slides. There's a couple of places where I'm going to pause and take some time for questions. After about the hour mark, right before the hour mark, I'm going to take a break. Give everybody 5 minutes just to kind of stretch their legs, refresh a bit, and then we're going to come back. We're going to have a panel discussion. So I'm going to share my screen right now, and that's always a little bit of a dice roll. So, all right, so I can't see your faces. I can't. That makes it challenging. Can make it challenging for me to see where you are, to see wrinkled brows. There's Brenda. If you do have questions, or if there's something happening with the technology, Amy can help with the technology issues. If you've got technology issues. If something I'm saying is just absolutely doesn't make sense at the moment, feel free to cut in. Otherwise, I'm going to leave some time for questions as we get through certain groups of slides. So this class is called Engaging Policymakers, Building Relationships to Build a Healthier Montana. Again, we're going to talk quite a bit this morning about how our public health system fits into the overall structure and systems of government in Montana. We're going to talk about the importance of, if there's anything I want you to come away from this class with, is an understanding of the importance of relationships. We are going to talk about, in down the road, we're going to talk about some of the nuts and bolts, some of the tools that you can use to engage policymakers, some of the tactical stuff that you can do to engage policymakers. But you'll notice that I'm not leading off with that, because I think the most important thing that you could take away from this is the importance of having relationships with policymakers that are important to your organization, important to public health, important to the work you're doing. That needs to start, as early as possible and be happening on an ongoing basis. Building those relationships. If you wait to an election, if you wait till the legislative session starts, it's probably a little bit too late. And when I say building relationships, I'm talking about people in your community, and I'm talking about just having regular conversations, nothing fancy. Our goal here, one of our other goals today, is to build that capacity to engage those individuals and institutions that have influence over your agency. That might be the state legislature. When we're thinking about the entire public health system, that might also be county commissioners. It might be somebody else. What we're talking about here kind of works all the way up to what's happening on Capitol Hill, and all the way down to the dog catcher. No offense to dog catchers. And then we're gonna, in the next session, we're gonna talk a little bit about some tools, and we'll have a little bit of work in between sessions, no more than 20 or 30 minutes. I want you all to become familiar with the legislature's system. They call it laws, and start to create a preference list and do some things in that system to just become aware of that, and to know how to use that tool. You can find out who represents you as well. So again, this is session one. I can't believe it's March 31st already. That blows my mind. That means a quarter of this year is by us. We're going to do a little bit of, we're not going to do full introductions. I think it'll take too long. But I do want you to take note of who's on the call, and I want this to be a conversation to the extent that it can be. I'm going to spend the first part today talking about our public health system and the government structure in Montana. And then we're going to spend some time talking about the 2021 legislative session, which brings me to what we're not going to discuss today. We're not going to discuss partisan politics. We're not going to discuss specific measures or specific, this is not an advocacy session. What we're going to talk about is how our government works, how public health fits into that. And we're going to talk about some things that happened in the 2021 legislature, but we're going to talk about that, and not whether those things were good or bad, but how they fit into and have changed the nature of how we engage our communities and how we engage policymakers. We'll take a break, probably about the top of the hour, probably about 1 o'clock. And we're going to come back, and we're going to have a panel discussion with 3 people who, at least 2 people, we may have one person who has a family issue that may not be able to make it. I have a panel discussion about how they engage with the legislature. In one case, the person is actually a legislator. And then I want to spend some time at the end prepping for the next session, and getting you ready to do a little bit of that homework, not much. I'm trying to be respectful of your time, to really engage the legislature system. Next week, we're going to come back. We're going to review and discuss that homework. We're going to talk a little bit about the Montana's laws and rules on lobbying and advocacy. And then I'm going to work with Lisa Dorak with the Confluence Public Health Alliance and really hand off some of this to her to talk about how our public health associations have changed over the past year or two, how they typically have worked with the legislature in the past, and how they plan to do that in the future, and how you can be part of that. Any questions about the schedule or the class objectives? Okay, let's get started. So I'm going to start at the top of state government. We're going to talk a little bit about how state government works. I want to acknowledge, first of all, these 4 slides that are blue. I want to thank Dan Clark at the Montana Local Government Center for helping me with that. I frankly just stole some slides from him. He sent them to me. But these are came from the Montana Local Government Center, which, by the way, is an excellent resource. It's part of MSU Extension, and it's a great resource to use to do a lot of things we can talk about later, including this sort of work. You know, the first thing to understand is that, you know, much like what we learned in American history, the way that our government works, the foundational elements of that is found in the Montana Constitution. And when it comes to local government, and when it comes to how the state and the legislature relate to local government, in 1972, the people who wrote the Montana Constitution embraced a shared powers model and not a home rule model. What does that mean? It means that specific powers are granted to local government, or in some cases, there's a limiting of power to intervene in local affairs, but it's not a shared power where all power except those prohibited. Actually, there's 2 types. I'm sorry. I misspoke. There's the home rule where you have specific powers. We're not a shared powers. About 45 other states are. That tends to give more agency to local governments. In Montana, there is really what you can do at the local level depends on what the legislature and the state government says you can do. Some counties and some local governments have general governing powers. That means that they can do what the legislature says they can do, whether those powers are provided or implied. And it says that those powers should be liberally construed. But like, I worked for 10, 11 years in Gallatin County. Gallatin County government is a general powers government. They can do the things that the legislatures, you know, explicitly tells them they can do. There is another type of local government in Montana called self-government. In Gallatin County, the city of Bozeman has self-governing powers. And that means the local government typically can do things that can exercise any power not prohibited by the Constitution or state law or the charter. So if the legislature says they can't do something, that's a significant difference. I will say, I'm not a lawyer. As I said, I'm borrowing these slides to the Local Government Center. The point here is not so much the distinction between, you know, general governing powers and self-governing powers, although that is something that you should explore. The point is that the important thing to know here and take away from this is that local governments, including boards of health, including health officers, derive their power from the state. And often that power comes in an authority, and those duties are derived from the legislature in a variety of ways. We're going to talk more about that in a minute. It's also worth noting that the way that the Constitution is arrayed, that every local government occasionally should take, every 10 years, should take a pause and have a conversation with its community about if that's how they want to continue to govern locally. And that's when things can change regarding the county commission or the city commission, regarding whether an organization has those, what type of powers that they're going to use under the Constitution. So this is back to our slides. And so what you have on the left there is that what should look fairly familiar to you from your civics classes, that you have these 3 branches of government in our state government, much like our federal government. You have the executive, the governor's office, and all the agencies that report to the governor's office. You have the legislature. We all elect the legislative branch, and you have the judicial branch that serves as a check on both the executive and the legislative branch. That functions at the high level very much like it functions at the national level. There are some differences in procedure. There's some differences in the way the legislature, we're not going to get into in this class. There's not enough time to do that. But just know that the governor and the legislature and the judiciary have a lot to say about how local government is authorized to do its work and the powers and the duties that they have. What typically will happen then is the legislature, one of the most common ways for this to happen is the legislature will work with the executive branch, and depending on who's in power when, and they pass state laws. Those laws are called statutes. And you can find those statutes in something called the Montana Code Annotated. And so if you see something cited that has MCA prior to it, you're looking at state law. You're looking at a law that the legislature has passed. If that happens, the legislature passes it, and the governor either signs it or vetoes it and is overridden. If it becomes law, then it goes into the Montana Code Annotated, and it often is then travels down and it affects local government. And you can see there, local government can mean a county commission, it can mean a city commission, it can mean the Board of Health, it can mean a host of other things, depending on what the statute that we're talking about is. It can also, the Montana Code can also be interpreted and empower state agencies. So it could be DPHHS, it could be the Department of Revenue, it could be any of the state agencies, or it could direct them to do certain work and authorize them to do certain work. Typically when that happens, those state agencies will put together what they call the administrative rules around a particular piece of legislation, and you'll hear people refer to the ARMS. And those are rules that are written in hopefully a transparent public way that should reach back to authority that is granted to whoever is writing those rules, whichever state agency that authority is granted by state law. In other words, the legislature and the governor have agreed in the way that they agree on things and create law, that they're going to authorize a state agency to put out rules. At the local level, the code, the state statutes is also often promulgated in a variety of ways. It might be through local ordinances, it might be through regulations, it might be through a health officer order, it might be through policy that is created at the local level, local laws that are created because the legislature has either said that the local government can do that, or in the case of a self-governing body, they said they haven't prohibited them from doing that. Give you an example of how this works in public health. So if you look at probably the most foundational public health law that we have is Montana Code Annotated 52-116. So again, you go back and you look, way back, the legislature and the executive agreed, we're going to create this law that called, within Title 50, we're going to create this part of Title 50 that really lays out the powers and duties of local boards of health. So you go to that Montana Code Annotated and you look, and it says the powers and duties of local board of health. Each local board of health shall, and I think that's important to really pay attention to the words here. It's not should, it's not may, it's shall. And it says the local board of health. And in this case, we're going to look at how we do isolation and quarantine and how we get the authority and under state law to do isolation and quarantine. Often, I know when I was health officer for the first 2 or 3 years, it took me a while to learn this process, to learn to understand this. I knew we had to be ready to do isolation and quarantine, but often nobody explains to you where we get that authority, how that authority comes down to us. I think it's really important that we understand that. So the legislature and the governor signs Montana Code Annotated Title 50-2-116 that says local boards of health, here's what you can do. And here's what you have to do. And it says the local board of health shall identify, assess, prevent, and ameliorate conditions of public health importance through epidemiological tracking, screening and testing, and isolation and quarantine measures. Well, that's nice. It's nice that they say that local boards of health, but how is that perpetuated? How is that carried out at the local level? Well, in order to do that, and then if you go a little bit further, 50-2-118 is the powers and duties of local health officers. And it says health officers they shall establish and maintain quarantine and isolation measures as adopted by the local board of health. So the code's saying, okay, the local board of health not only is responsible for this, but the local board of health is going to establish these measures consistent with state law. So if you look in Gallatin County as an example, I'm just using that because that's the one I know. The Gallatin County Board of Health passed an isolation and quarantine policy back in 2017 that really harkens back to the administrative rules of Montana, which we'll get to in a minute, and those state statutes. It says upon confirmation of the diagnosis that a disease meets the definition of a communicable disease, the local health officer shall consult the administrative rules of Montana, and the most recent control of communicable disease manual. That's the manual that hopefully if you're in local public health, you know well, or at least you have on your desk. That's CCDM, because that's what is referenced in the administrative rules of Montana. We'll get to that in a minute. And then it says if the disease is not specifically listed in CCDM, such as a certain virus that we've all been dealing with for the last 2 years, which isn't in CCDM because we haven't had the time to get it in there over the last 2 years, the local health officer shall consult other guidance such as the CDC's MMWR, the state epidemiologist, or CDC recommendations to determine the least restrictive yet effective control measures available, including isolation and quarantine. And again, this is the local policy, but it is written with our lawyers, and it looks back at the Montana Code Annotated in the arms to make sure that we're doing this legally. And it authorizes the health officer to identify contacts of the case if required. And it says we shall follow investigation requirements set forth in the administrative rules of Montana. What is that? Again, go back, and what I referenced is the state agencies, DPHHS, puts out these administrative rules of Montana, or these administrative rules that say, immediately after being notified of a case or outbreak of a reportable disease, the local health officer must take steps as outlined in the Control of Communicable Diseases Manual to prevent and control the transmission of disease. And so that's where you can really trace back from the Constitution to the statutes, to the administrative rules of Montana, and to local policy, the work that many of you are doing on a daily basis that often we lose the connection to where we get the authority to do that and where we get the powers to do that. That's where that comes from, and it's really important that we maintain the connections to those administrative rules and to the Montana Code to really be able to understand where we're getting that authority, where we're getting those responsibilities, and what our duties are. And it's really important to understand it's not just something we can do. What this is saying is the health officer must do this. And so as you look at those minimal control measures that are in the administrative rules, it actually says, as we're doing this work, it points at the Control of Communicable Diseases Manual, unless the disease is not in CCDM. And so that's why CCDM has become so important to our work. It's not because we think it's a good book, although we think it is. It's not because we just made the decision. It's because the administrative rules of Montana said, yeah, that's going to be our playbook. We think that is our playbook. Now, here's what I will tell you. As you have all know, and as we've all learned, the devil is in the details as you do this work on an ongoing basis. And it's really important it's really important that you maintain those connections to the state health department. It's important that you don't regard this as some sort of static body of knowledge that never changes. It's important that you continue to have conversations with the epidemiology staff at the Public Health and Safety Division at DPHHS. The point I want you to take away from this is it's really important for us to consider and understand that the work that we're doing is fastened to state law, and it's fastened to state government. And as we interact with policymakers, it's really important that we do so in a way that takes into account what our duties and authorities are.
Matt, there's a question in the chat from Amy Lohman. She's asking if there should be documentation between the HO and the authorized representative.
When you say authorized representative, what do you mean by that?
Amy, did you want to elaborate on yours?
Yeah, sorry about that. So essentially one thing that we've been, while we're in kind of a lull with COVID, we're really digging back into a lot of our plans. A few slides ago, you talked about kind of how it's delegated from our Board of Health, and then it's actually our health officer is the person who is legally responsible for any epidemiological investigation. However, that has been delegated further to our local health or public health. And I think that's super common across, a lot of our counties. However, I've never been able to figure out, and even asking our Board of Health and our health officer, are these administrative rules enough to suffice, or should there be some sort of formal documentation stating that the health officer has been delegated and chosen an authorized representative, which is the epi team at the health department?
So
does that make sense?
Yeah, and
Okay.
Drenda, feel free to speak up, Drenda, if you feel like you have. I mean, you've been at this for quite a while too. I would say two things. One, sometimes yes, sometimes maybe not. And the maybe not in terms of like whether or not if it's in code, if it's in the administrative rules of Montana that the health officer is responsible for that, that's pretty clear that that's your duty, that's your authority. What I think is in a practical way, and what you're hitting on, Amy, is that, there's a lot of things that as a health officer, when I was health officer in Gallup, that says the health officer would make inspections for conditions of public health importance. I wasn't out there making inspections. I had sanitarians and I had nurses out there making inspections. And so different counties have different ways to pass that authority on to the health officer. So if it's a duty, for instance, the duty that's attached to the Board of Health, the Board of Health is responsible for controlling the spread of communicable disease. The Board of Health in Gallatin County, I'm not saying this is the only way to do it, approved that specific policy that specifically said the health officer shall identify contacts of the case. It was a local policy that, as health officer, gave me the clear legal authority to do that work on behalf of the board. So I would say, if it says you have that authority in state law, then you might not need to have that additional policy. But we all know that the way health departments operate, often those duties are delegated to people by the health officer or by the Board of Health. And I do think it's important that you talk to your attorney. I'm not an attorney. It's important that you talk to your county attorney about the way that you memorialize how that relationship works. I think it is important to have those in place, and different counties will do that different ways. It can be through policy, it can be through an interlocal agreement, it can be through resolution, it can be through, in some cases, procedures. It might be that the health officer signs, in Gallatin County, I actually, every time we hired a sanitarian, I would sign a form that said I'm authorizing them to fulfill these functions on behalf of the health officer. I'm not going to tell you that everybody has to do that, because one thing I've learned over the last year is different counties get different legal advice. What I would say is that it's definitely a conversation that I would have with your county attorney or whoever your county attorney is delegating about how you want to make clear whose job is what and where that authority is coming from. Dorinda, do you have anything to add to that?
I can just share, I would reiterate that every county is going to do it different. And so we here in Lewis and Clark County, we rely heavily on the MCA and the administrative rules when it comes to isolation and quarantine. And then what specifically it looks like as far as operationalizing is outlined in our communicable disease plan, which goes before the Board of Health every year for review and essentially adoption. But it's in plan form. So that's how we do it here. But that is our link between how we operate, how we operationalize, the details of how we operationalize back up to the law and the administrative rules.
Amy, is that helpful, or are we missing the target there?
No, that's very, very helpful. Thank you. I really appreciate it.
I can't stress enough how important it is to develop that relationship with your county attorney. And I will tell you, there are going to be counties where the county attorney was elected and views himself or herself as a prosecutor of crimes. And this is not something that is naturally in their wheelhouse. And that's why that Public Health Institute has tried to help create some documents to help this process along. But I'll tell you, often lawyers just want to do it on their own, and sometimes they want some help. But I do think it's important that as you read the Montana Code Annotated, as you read those administrative rules, that having local documents that are really clear about how you're gonna execute those duties and authorities is really important. But how you do that really is going to have to be a conversation with your county attorney. I wish I could be more specific, but I'll tell you, if I told you to do it one way, you're probably going to get different advice from your county attorney. So I want to be really careful about that and respectful of their work too, because they're the ones that are going to have to defend you. The other thing in Montana Code is the county attorney, by the way, is required to be the legal counsel for the Board of Health and the health officer. And so that you can point to that statute. I wouldn't do it in a you have to do this kind of way, but say, look, you're my attorney. I'm really trying to get my head around how these substantial duties are parsed out and who's going to do what. So again, we go back to this slide. In this case, we had the Constitution gave the legislature, in consultation with the governor, influence from the governor, and then oversight by the judicial branch, the authority to pass state laws. They use those state laws to say, hey, we need to protect the public health in Montana. We're going to protect the public health by creating these boards of health in all counties, and every county and every city of a certain size is going to have a board of health. That's what the statutes say. And then that gives local governments the authority to do the work of creating boards of health, and it gives health officers and boards of health the clear authority then to promulgate whether it's a policy or a procedure or something else, how that work is going to be handled at where the rubber meets the road. Same thing is happening at the state level. When the state creates its administrative rules, one thing to really key in on is there's never an administrative rule created. There should never be an administrative rule created where the public and you all don't have a chance to weigh in and say, hey, I think you're not quite getting this right. I think you need to adjust this or tweak that. That's a very formal process. You can submit comments, and there are different ways to get involved with that if you do. The bottom line here is the stuff that you're doing, isolation and quarantine and testing and the work of public health in the state of Montana really follows this kind of word chart. Other questions out there? Okay. I'm not seeing questions. I'm going to keep going. And we're going to talk about some changes made in 2021. And I want to reiterate, this isn't a partisan session. This isn't an opportunity for us to complain about something that happened in 2021. This is really, I really think of it. I do think it's important for us to try and understand these changes because it impacts our ability and the effectiveness of communicating with policymakers. So we're gonna dive into that a little bit. I think you all know, but I think it's worth reiterating that Montana is a decentralized public health state. The legislature, under its constitutional authority with the governor, has said we're not going to drive all public health decisions from the state level. We're going to have local boards of health. Local boards of health are gonna create policy in some cases. Some of this has changed. They're gonna be responsible for overseeing public health in local counties. And again, that law says there is a local board of health that serves every county and in all cities of a certain size. So in Gallatin County, the Gallatin County Commission is required to have a board of health, as is the city of Bozeman and the city of Belgrade. That will be different in different counties. Some of you may have a county where you don't have a city that's big enough to qualify under this, and it's just a simple county board of health. Somewhat larger counties, and in some smaller counties, you have a city-county arrangement where the cities and the counties work together because they don't want to have separate boards of health. I don't know of any counties at this point in time where they have a city health department and a county health department. Usually where there's a requirement to have two, they work together and collaborate. And then elected officials in the counties can choose from a number of different structures for their local boards. They can have the boards appointed just by the county commission. That's what tends to happen in some of the more rural counties where there isn't a city. I think it's a first or second class city that I think it's about 50,000 people right now is the threshold. No, that's not right. What is it, Brenda?
It's a second class, and I don't know the population.
Belgrade just went over it. I think they're 10 or 15,000, something like that. So, and then, you can also have, I don't know that we have any, you can also have a board of health appointed by a city commission. That's allowed under state law. And then what tends to happen in larger counties where there are cities and counties is a city county. That's why it's Gallatin City County Health Department. Lewis and Clark is the same way. Flathead County is the same way. Missoula is the same way. Beaverhead County is a city county health department. And then what I know less about, because I have less experience with it, is there are health districts. In Yellowstone County, we have a health district. Riverstone Health is a health district, and I would defer to John Felton and his colleagues to explain how the heck that works, because that's a whole different level of complexity that stems to a different part of state law. The Central Montana Health District is a health district that connects to a different part of state law. But the bottom line is they all have these local boards of health, and those local boards of health, if you look at the Montana Code 52116, these are the powers and the duties of local boards of health. And I underline duties here because I think it's important to understand these aren't just necessarily things that they say we can do. Well, there is some of that in there. There are some mays in the language. It's also important to know that where it says shall, it means you have to do that. It means it's your duty as a health officer or your duty as a board of health to do that work. So again, just to reiterate, and I think it's really important that we don't lose track of that Montana Code annotated 52116 says that the local board of health shall identify, assess, prevent, and ameliorate conditions of public health importance. The Board of Health shall protect the public from the introduction and spread of communicable disease and other conditions of public health importance. The local Board of Health shall supervise and make inspections for conditions of public health importance, issue written orders for compliance, correction, destruction, and removal. You have to do something about this if somebody's out of compliance, and bring in and pursue actions necessary to abate, restrain, and prosecute the violation of public health laws and rules. Those are some pretty big responsibilities, and they're attached directly to the Board of Health in Montana state law. Likewise, in Montana code, just two subchapters later, the local health officers shall, again, that word shall, make inspections for conditions of public health importance. The health officer has that duty to take steps to limit contact between people in order to protect the public health from imminent threats. Establish and maintain quarantine and isolation measures adopted by the local Board of Health, and pursue action when appropriate with the appropriate court if rules adopted by the local board or the department are violated. That's duties of the health officer in our code. So in 2021, I'm sure you have all heard the legislature.
Can I interrupt
Yeah.
for just a second? There,
Sure.
Margaret is asking a question. She's asking, how do you utilize this power if your county attorney and local law enforcement are not willing to intervene?
It's very difficult, and a lot of people ran into that, including yours truly during COVID. You really don't have, it really limits your ability to do that. Hence, now I will say this, where we did do it, we absolutely could not have done it in Gallatin County without the help of the county attorney. You have to have that relationship, and that's where I go back to, it's so important to have those relationships in place before you need them. It's important to understand, and you might have those relationships and they might tell you, hey, we're not doing this. Well, that's a problem that you have. You have a duty, and the person who is standing between you and that duty is saying they don't want to do that. That's a problem. It's absolutely a problem, but you need to know that to be able to work around it, to make decisions about what you want to try to do, what you can't do. But it's a spot on point that if you don't have that relationship, if you don't have, now remember, they are your attorney. I can point, I don't have it at my fingertips, but they are your attorney, and you can point to specific state law where they are required to be your attorney. So they need to, they really should be providing you with that, but you're hitting on a really difficult issue. But I would say the first stop is your county attorney. If you can get your county attorney, often they can be a conduit to law enforcement. But it was an issue that we had even in the larger counties. How do you implement, enforce, and convey those public health rules? And it's become even more complicated, as we're going to see here in a minute. So before 2021, the Board of Health, they had these two pieces of legislation, HB 121 and HB 257. They were eventually kind of wrapped into one piece of legislation called HB 257. Prior to the passage of that, the Board of Health appointed and fixed the salary of the local health officer. The Board of Health chose who the health officer was going to be. And the Board of Health could directly adopt regulations that were not in conflict with state law for the control of communicable diseases and dealing with other issues like, it's old timey language, removal of filth, that's sewage, that's stuff like, things that environmental health hazards, those kinds of things. After passage, after 2021, the legislature passed this, the governor signed into law. The Board of Health was moved into a status of recommending to this new governing body that the law created the appointment of the health officer, and also proposing for adoption by the local governing body regulations that do not conflict with state law. In other words, the Board of Health in these two limited areas, there was authority and duties that were taken from the Board of Health, and they said, we're gonna convey those to this new governing body that every county needs to create. In a lot of counties, especially the more rural counties, that governing body is likely the county commission because there isn't a city. And in the larger counties, I think with the exception of Flathead and Lewis and Clark, they're still trying to figure out how this is going to work. They're still trying to build their local agreements to figure out how the cities and the counties are going to work together to do this. But again, these are important. but there are limited ways that the legislature changed the duties and authority of local boards and health officers. What I would say is, and then it says you have to create this governing body. Well, what is the governing body? The governing body could be one of three things. It could be the Board of County Commissioners, and that Board of County Commissioners, in smaller counties where there isn't a class 1 or class 2 city, that is likely the role the direction you're going to go. It could be the elected governing body of a city, so the Bozeman City Commission, or it could be an entity identified as the governing body by through a document, through bylaws or interlocal agreement by the city and the county working together. And that's what Lewis and Clark just finished. That's what Flathead County has done. Gallatin County is working on it. Missoula County is working on it, and they're all taking different approaches. I'll say this, like it is a work in progress in a lot of these counties, and they're taking different approaches, which is going to be interesting and challenging moving forward. So the changes made in 2021, they said these two things, this new governing body is going to appointing the health officer and adopting rules and regulations. That's going to go to this new governing body, and here's what the governing body looks like. And then it also made some changes related to whether or not anybody, not just the health officer, but even the county commissions, can make rules that inhibit the functioning of a business. This is probably maybe one of the more consequential parts of this legislation, although it doesn't just affect local boards, it really affects all local governments. And it says that, you know, a law or a local regulation may not interfere with physical attendance or operation of a church, synagogue, or other place of worship. And then there's some language in there about can't interfere with a business's ability to serve its customers. Those are pretty broad and pretty sweeping changes, and we're still adjusting to those. I put them in here not to dwell on them, but just to acknowledge that those changes were made. For the purposes of this conversation, I think it's important to really think about what they did to the authority of local boards and what they did to the authority of the local health officer in relation to county and city commissions. So there's some more stuff. We're going to keep going a little bit here. But what I want to really focus on is what did not change under this legislation in 2021. If you go back, even after they changed the Montana Code annotated for all those changes, what you will find in MCA 50-2-116, it still says the Board of Health shall protect the public for the introduction and spread of communicable disease, supervise or make inspections for conditions of public health importance, and bring and pursue actions and issue orders necessary to abate, restrain, or prosecute the violation of public health laws. That is authority and duties that still rest with the local Board of Health. Now, how this all interrelates, that is an ongoing conversation in a lot of counties, maybe most counties right now. But the point here is that, yeah, they did make changes. Those changes were were substantial, but they were limited. And the Board of Health we're still a decentralized public health state. The Board of Health should still have authority to do its work. I will say that that's still up for debate in some corners of Montana, but that is the interpretation that we have at the Montana Public Health Institute after consulting with some people who have law degrees and are licensed in the state of Montana. Again, I'm not giving you legal advice. Your legal advice needs to come from your lawyer. I'm giving you our interpretation of what those changes did. Again, with the health officer, if you look at 50-2-118, it continues to have substantial duties and authority that are vested in the health officer. I'm not going to read these to you again, but you can see the health officer still has a big job, still has a lot of duties, and should still have some power to do those duties. So, you know, in summary for this section, what I want you to take away from this is, if you are working in local public health, whether you're a Board of Health or a health officer, or a staff, or a director of a lead local who's the director, or a sanitarian, or somebody who works in environmental health, or a VISTA or an AmeriCorps volunteer, or you're one of the governing bodies that was identified under this new law, there are a number of state partners, including the state level, the governor, the legislature, and the courts, and all the state agencies that report to the governor and are affected by the legislature, that you need to affect the work you do. They really tell you, they really have a lot of impact on you. In addition to that, you're impacted by county and city commissions really substantially. A lot of appointing your board, appointing who is on this governing body, in a lot of cases, deciding how you can spend your, how your budget works, how much local funding you're going to get. That's all really important. And I put county attorneys on here very specifically. I think if you need to have that relationship with, you need to have a lawyer. You're part of an organization. Every organization needs to have a lawyer to be their advocate. You need to build that relationship, and I would really strongly advise you to do that. Okay, that was a lot. We're gonna take about a 5-minute break here. I see Kathy Kelker. Kathy, do you like Kathy or Catherine? I'm sorry to assume there.
I'm called Kathy usually.
Okay, well, thank you for being here. We're just finishing up the first sort of session of this today. I want to open it up for questions. Do we have questions out there about sort of the basics of how our state government works? Okay, great. Let's call how about an 8-minute break? We'll come back at 1 o'clock. We'll come at the hour. 7-minute break now. We just lost a minute. And we're going to come back with our panel. You guys see that okay?
Sounds good.
Is it advancing okay?
Yep, we're good.
Okay, great. So maybe a little later we'll have Barb Schneeman. Barb Schneeman is the Vice President of Communication and Public Affairs for Riverstone Health. If she comes in, I'll introduce her so you know who she is. Barb has worked with us in public health ever since I've been health officer. I didn't know this until today. She's first a board member for Riverstone and then staff for 19 years. Prior to being with Riverstone, which most of you know is the lead public health aid organization in Yellowstone County. Barb worked with the National Center of the American Heart Association, where she was responsible for state-based advocacy. We also have with us, and I really appreciate her time, Representative Kelker, representative of House District 47 in the Montana legislature. I'll let her tell you where that is and who she represents. She's an educator by trade, with a doctorate in special education and a lot of experience in K-12 programs. And her legislative interests in the legislature include healthcare, public schools, and public safety issues. And then we have Jean Branscombe, CEO of the Montana Medical Association. Her membership are physicians all over the state of Montana. And a lot of her time is devoted to leading advocacy efforts on behalf of her membership and her organization, and having influence on state and national regulatory and legislative proposals that impact the practice, how we practice healthcare provision in Montana. I will also say, I want to thank both of these women because during the 2021 legislative session, as you all know, public health was up to its eyebrows in hard work. Jean, I want to thank you directly here because I know that you stood at podiums and you took barbs and arrows from a lot of people when a lot of us were trying to figure out how to administer vaccine and how to do things that we had never done before. And so Jean stood up and she was a voice for us at a time when not a lot of us had the time to be a voice for ourselves, and frankly, at a time when it felt like our voices weren't being heard particularly well in Helena. So I want to say thank you to both of you for your service. I'll let you let's just start with Representative Kelker. Why don't you introduce yourself and just spend a few minutes talking about what you have here is an audience of public health professionals at the local level, going from health officers who have been in it for a long time, like John Neiman, to AmeriCorps volunteers who are just coming into it for the first time, trying to better understand how to engage policymakers and their state government. So I'll let you take it away, Representative Cochran.
Thank you, Matt. I'm very glad to be able to talk to this group of individuals. Please tell me if I'm not talking loud enough, because I have kind of a soft voice. My House district is a very interesting mixture. It's quite diverse. I have downtown Billings, which includes a lot of apartments and banks and all that sort of thing, and our 2 hospitals. And then I have North Park, which is the lowest income part of Billings. And going west, I have kind of old buildings, old houses in Billings, but really nice ones. And people who are very well educated and are very big contributors to the community. So I have sort of everything going on. And I've enjoyed the process of getting to know my diverse people. My reputation is that I knock on doors, and that's what I did this morning. What else did you want me to talk about besides my?
Well, as a legislator and somebody I know, as somebody who's myself been in legislative sessions, I've seen how incredibly busy and swamped you all are. And everybody thinks their issue is the most important issue. That makes it really difficult for you. So what's good for this group to know as they engage legislators in Helena?
Well, I would suggest first, before Helena and before the legislature is in session, to get to know the legislators who live in your area. And that shouldn't be hard to do. If you invite them for lunch, or you bring them in for a tour, or you ask them to speak, if you have a community gathering going on, there are any number of ways that you could get them into your hands. I like the intimate contact, like a lunch or a breakfast or something like that. The real trick in getting to know legislators is getting to know them as human beings, even though they're not, particularly interested in public health. They are people who have constituents who need public health, and that's what they have to learn. And you can tell them who comes to get your services, what kind of services do they get. And I think a lot of legislators don't understand that, like the sanitarians, people who are working with restaurants and so forth, and that's businesses in your community. But I would find out, do they have a family? How long have they lived in your area? What is their job when they're not at the legislature? And really get a feel for what's important to them. And then you can often find that there are connections. For example, I know of one kind of crusty legislator, I'll just say that way, who is very impressed with public health help with new babies. And he's very willing to support efforts and provide money for helping young people who with new babies get through those first few months. And I was surprised, because in other realms, he's not necessarily that generous, but that can happen. And so in the smaller towns, this will probably be easier to do, but it might be more necessary in a small town to go one-on-one, so that the legislator will actually be as forthcoming as possible. And I would definitely say, let's not talk politics. Let's not talk about, voting or any of those kind of things. Let's talk about why we have public health, why it's there in your community. And some of the legislators don't realize that we have kind of minimum services in public health in Montana. And there are more things that are done in other places that might be very helpful in your community. So kind of give them the big picture. If you have healthy people in your community, that's good for business. And those kinds of comments, really need to come out.
Good.
Excuse me. Go ahead.
No, thank you. I appreciate it. Didn't mean to cut you off.
And if there are some organizations in your community or in your county, like the commerce people, or just
Chamber of Commerce.
Any kind of group, the Lions, the Elks, the whatever there might be, you get on their list to give a luncheon speech, so that the members of those kinds of clubs know what's going on. And just I think always stick to how valuable everyone's health is. I mean, all of us want to be as healthy as we can be. And there are lots of things that public health professionals know how to do that will help all of us be healthy.
Thank you, Kathy. Jean, do you want to talk to us about, I didn't get all of your bio onto the PowerPoint. Please feel free to fill in the gaps. Tell us about your experience with the legislature and as you talk to your membership, your do's and don'ts moving forward. You're still muted, Jean. There you go.
Well, I was giving you just royal praises, Matt, so you missed all that. So sorry.
That's all right.
There you got it. There you got
That's
it.
the best part to me.
Thanks for doing that. And yeah, Representative Kilker, you're a rock star of the Capitol. Thank you so much. You talk about an individual that knows healthcare and is a go-to person in regards to really how to get things done. This is the person you go to that can give you advice when you're having a rough time up at the Capitol, to say, here's how to get things done, and here's a go-to person that you might talk to when things are kind of getting rough up there. So thank you, Representative Kilker, for all you do for healthcare and kind of being that needed voice that we need up there during the good and bad times when it gets rough. Thank you for inviting me to be here. I work for physicians. I'm a champion for physicians, and that includes the patients. And we are definitely a shared voice when it comes to talking about patients. And I feel that we have a common cause with our friends in public health, and certainly learned lots in the last few years in regards to the tremendous amount of work that all of you do in public health, and feel for the pain that you've gone through, and have really enjoyed learning and appreciating what you have done. And as we're talking about what we need to do that together. And that's part of what Matt had indicated, is that when we're talking about building relationships with legislators, right along with that is building relationships with other associations and other lobbyists, because it's people like me that can step in when you're tired and worn out, and maybe your effective voice is not as effective because of things that are out of your control. There's other folks that can step in and be your voice and help you out. And that's what physicians wanted to do. And we were glad to do that this last session, to do what we can do to be helpful in regards to that. I'm CEO of the Montana Medical Association, been doing that for about 10 years, to celebrate my anniversary time period of 10 years, spent 20 years in state government prior to that, was policy advisor for a couple of governors, executive director for the Board of Medical Examiners, and actually ran the regulatory shop as a deputy secretary of state during that time period. So I have a very unique view, because I've been able to sit inside state government, who is promulgating rules, I sat in the governor's office and worked with legislators that direction, and worked in the executive direction and saw that side, and then lobbying on the outside as the CEO of the Montana Medical Association. So I have these different perspectives of getting laws through and lobbying on different aspects that have given me a variety of different perspectives. And as you've kind of heard through your conversations, it really gets down to the grassroots effort that needs to occur in building relationships and just having conversations and really getting to know your neighbors and finding ways to have a buddy to help you be comfortable in situations that you think might be uncomfortable. But when you start having conversations, you find out that it's extraordinarily a fun and enjoyable task. And that's what I would encourage you to think about. I can tell you that you probably feel the same way that physicians feel, and they don't like the word advocacy and they don't like the word lobbying. And so I am told all the time not to use those words. So we just have educational talks. And what I would encourage you to do is just kind of think about getting to know another community member who has happened to have something happen in their life that has given them the positive and the reason to serve Montana in a very public life. And that's just be a legislator, and to be curious about that. Something happened that gave them the reason to raise their hand and say, I'll run for office because I'm really disturbed that that happened to me or that happened to my family. And that gave them reason to run to fix something legislatively on a bill, and asking them about that. And that's really what Representative Kelker was talking about, is having that common ground and that conversation with them. And it'll be interesting as to what you'll learn as to what happened to their neighbor or their brother or sister or mom and dad. And you'll find a common reason there for which we'll probably leap into a conversation that has something to do with public health. You will find some kind of linkage, and that will formulate down the road a linkage and a strategy that you'll be able to use down the road to speak to them about a bill of interest to you when it comes to the time when they're in Helena and looking at legislation. But when you're wanting to have that cup of coffee with them, what you're wanting to do is just have a remembrance of a name and a handshake, and just be a resource to them, so that when something does come up in Helena, that they might remember your name and know that you're really an expert and a resource that's there to be helpful. So kind of my advice is to, kind of be brave and step out of that comfort zone, and just know that they're a human, like Representative Kelker talked about, and just get to know them as a human and be curious about them and why they're running, and be helpful to them. And know that when I do polling and ask legislators about connection to physicians, 95% of them want to be connected to a physician. They want to have a resource that's available to them during session that they can call. And I darn well bet that if I asked the same question about public health, it probably would be 99.9%, because I bet you a whole bunch of them don't know much about sanitation and public health. And those little events that happen that can a little controversial at session, they'd like to call someone that's kind of safe back at home and say, this little issue is getting kind of hot. Can you kind of tell me what's going on? Because they don't want to walk into hot topics at the Capitol and do something that's going to harm their community. They want to, pick up the phone and talk to someone that's safe back home and kind of get an understanding, so they don't do anything that harms their community. And that's who you guys are. That's why it's great to do that. I think the other thing in regards to what's kind of unique about all of us is that everyone has a healthcare horror story. So just know that. And just know that right off the bat, you might as well figure out what that is, because you're going to have common ground right there. Public health has got something attached to healthcare. So just go ahead and figure that out, and it's going to emerge somewhere. Something happened that was really bad to something in their family. So go ahead and hear it, be understanding, compassionate about it, and just keep that in your pocket, because down the line, something's going to happen and you're going to be aware, just like Representative Kelker talked about. You're going to have that person that you would never expect that would ever help you, but down the road, you're going to remember. And I've had the same experience. I know a person that has had individual that's an alcoholic. And when I have a bill, I can go back and talk about the individual that has the alcoholic. And I can go back and talk about substance use disorders. And I can talk about suicide prevention and lots of public health things. And I go back to that one common thing that I know that's a thread of common interest with that person that leads back to public health. And those are all great things on building that relationship that all of you can do real easily with those individuals. And I just want to reach out and let you know that, again, it just is kind of scary to do that. And it's the same thing. It's scary for physicians to do the same. And I would just say, let's create a buddy system that let's go out and be buddies, that let's pair up a physician with you or you with a physician, and let's have little meet and greets and go together in a pair and meet these legislators. I'll be going out and doing that too. And let's go out together and shake hands with them, because they're all new. And if they're around, I think let's do it together, because that just makes it strong, feels better together, and we're all stronger doing that together too. So those are my pieces: is be curious, be helpful, be understanding. And while you're doing that, you're always strategic. You're always getting that information and just say, it's data, baby. It's data, baby. Put that information in your pocket, because you're going to be using it later.
I really like what you're saying about being curious about their motivation for being in office. I think that, policymakers are not unlike anybody else, and maybe even more so. They like to talk about themselves, and they like to talk about what they do and what motivates them. And so I think that idea of that initial meeting, that phone call, just having your business card saying, I want to make sure I know who you are. I want you to know who I am. I want to be a resource for you during the legislative session. And we live in the same community. I want to make sure that we're working together for that community. That seems like simple enough way to do that initial engagement. Is that seem on track, Jean and Kathy?
Very much so.
Yeah,
That's very much the way to go. I think if you have those relationships at the local level, you also will have a sense of what maybe myths people have about healthcare, about hospitals. I've met a number of people as I knock on doors who don't want to ever go to the hospital because that's where you die. And I thought that myth had gone away a long time ago, but it hasn't. And the other piece about healthcare is a number of people are afraid of how much things cost. If I get this help, if I ask for help, it will cost a lot. And I think you have a really good chance as public health professionals to say, we're saving you money. We're doing prevention. We're helping people get healthy in basic ways so they won't need as much expensive healthcare in the long run. And if you can have some examples of that in your community, I think that goes a long way. The other thing I often talk about is that Montana is still a frontier state, and there are lots of places where they're a very scattered population, and it's really difficult to attract medical professionals into those areas. And if we don't make it a welcome place, if we are not open to working with professionals in the healthcare realm, then you won't get doctors, nurses, CNAs, all the people that are needed in your community or close to your community to help when you do need to go in to see the doctor. So, I mean, those myths that are still around, it surprises me a lot. But I think the public health people are on the positive side of things, because you can say, here's what we know about how we help people with their health care if they're vaccinated or, you know, whatever the thing is. You really have some good stories to tell that make things much safer in terms of health in the local community. So after you get the first chance, the first opening with some legislator, then you can maybe bring them into, you know, something a little more hardcore. One example I'd give you is at the Billings Clinic, they have a tour that for legislators and others, and they have them come in for almost a full day, and they spend a lot of time in the ER, so they could the emergency, so they can see who comes in with emergencies, and it's a life-changing experience for people who have not seen the many things that happen in healthcare. So, you know, if you can give them some examples, let them see what's happening in your community and how good it is for people's health, I think that would be a big open door for public health.
Brenda, I'm going to put you on the spot, even though I didn't tell you I was going to do this. And we do it. So just so you all know, we kind of abuse Brenda during the legislative session because she's in Helena. And she often gets I don't want to say the short straw, but often she's the one that ends up schlepping up and providing testimony or talking to somebody. So you have quite a bit of experience with it. What are your thoughts on, as a lead health official who's done this, lead public health official who's done this for quite some time, tips, tricks, thoughts?
I'm guessing you're calling on me because Barb wasn't able to get here and you have to fill some time. So I'm happy to
think I've got enough questions here to fill time. No, I really am. I think
No,
I think you have a lot of experience, so we want to have that access to that.
Yeah, I so appreciate the wisdom that's already been offered by Jean and Kathy, because I think they're spot on outside of the legislative session. So I think the one piece that I can contribute is what it feels like during the session. And those conversations are still really important, but they're heard differently by our legislators. So when there's an actual bill sitting in front of them and they're deliberating on the details and trying to figure out what's best for their communities, if you don't have that relationship that was kind of formulated in advance of the legislative session, you won't be helpful, because you're a stranger in that moment and they're under pressure and they're hard to connect with and they're hard to track down, and even giving them food is not enough sometimes. So I think the wisdom of just, you have to take the time now outside of the session to build those relationships, have that done in a really, you know, gentle and natural and you know, outside of a pressured situation. The legislative session is a whirlwind. It's a real whirlwind, and things happen very, very quickly. And as far as testimony is concerned, you have to be direct and you have to be to the point, and you can't fumble around. You have to get up at that podium and you know, hold your head high and tell your story about what's happening in your community. I think those stories about, you know, families that you're serving or impact that you're having, that's what they're going to hear, if they hear it at all. Because again, it's what happens outside the session that really connects with our lawmakers. And so I don't know if that was helpful, Matt, but
Yeah, I think-
it's really a challenging environment during the session. And so,
I mean, at its root, politics is just people trying to figure out how to govern themselves. And we put a lot of baggage on that and we make that really complicated and really divisive. But at the end of the day, they're real people. They have their viewpoints. And I think the couple of things that I've been hearing here is being curious and listening. And now is the time. I mean, before the primaries, before, you're doing it when they have time, number one. They're not under pressure, number two, on specific legislation, and they have some ability to think more freely. Once they get into the session, they're getting whipped by the that's a term for vote counting and getting their votes in line. It becomes much more pressure packed and it becomes much more difficult. So being curious, and then the other thing I say is think about ways to get their head nodding. I mean, we tend to speak in data sets and grandiose ideas, but you got to think about ways to communicate with policymakers that'll get their head nodding. And here's an example. You can go in there and show them all the data in the world about suicide rates and about, how, ACEs scores and things like that. But if you're from their community, you can go and you can sit with them over a cup of coffee and look them in the eye and say, hey, tell me what you're thinking about with substance use in our kids. Or tell me what you're thinking about. Did you know that we have, 59, I'm making this up. We have 57% of our high schoolers are vaping right now. Did you know that? What do you think about that? And find ways to get their head nodding in those initial conversations. And then that can lead to conversations about what they're interested in. Because once you know what they're interested in, that's, again, like Gene said, that's all data that you can file away. And I'm not saying to use, but we all interact with each other as human beings, and they want to be interacted with as human beings, I think. So I think those are some things that you can do pretty easily right now. It's way easier now than it is once the session starts to make those phone calls. I'll throw this out to all three of you, this next question. What are some things to not do in engaging public officials?
I have a few suggestions, if that's okay.
Yeah.
During the session, the legislature is, as been described here, is very, very busy. And so it is hard to get a message to a legislator. But what I find is the most helpful is email or text, because I can be sitting in my seat on the floor and look at my phone and say, oh gosh, the public health professional in my county wants me to do X or whatever. Then I can absorb that information. We get, well, like in a week, we maybe get over 1,000 messages. Some people still get them on paper. I do mine all on the electronically because that's much more efficient. But it is just overwhelming. But if you already know that person, the public health person, and they contact you in the way that's most efficient for that particular person, you just have to ask them, is it better to call you on the phone? That's really hard to do. Or, whatever works for them is what you should try to do. The other thing that's very good and something that you should try to do and is to understand the bills that are pertinent to you, and don't make the mistake that the legislature is going to understand it at all. Very few legislators know as much as you do about the things that are involved in public health. And it is very helpful and really people will listen to you if you obviously understand the impact of the bill. Not to get into too deep in the weeds, but if you can say, please listen to me. This is the effect in your hometown if this bill passes. And be very knowledgeable and able to answer the questions. Don't try to talk about a bill unless you really know what you're talking about.
What
I'm
about
gonna-
data? Sorry, Jean, go ahead.
I was just gonna say that experience that I would say is just appreciate whatever viewpoint they have. So if they do not agree with your viewpoint, appreciate and respect that. Don't go below the line. So if they berate you, and don't go there with them. Stay above the line and be professional at all times. Do not talk ill of other legislators or lobbyists, because that word will travel. And do not do any ill talk or that by any means by texting or email, because that will get copied and travel quickly through the hallways. Do not lie and do not bullshit or give half truths. Representative Kilker talked about know your stuff. So if you don't know it, say you don't know it and go get it and bring it back. But don't try to work your way through the hearing or say you kind of think you know, because that doesn't work. Be truthful with them and get back with them. They respect that and they're making decisions based on that. And I think you always give the 360. So if you're given your viewpoint and you know what the other side or the opponents are going to say, let them know that so that they can trust your word and your appreciation of that. So if this is how you view it, go ahead and say, you know, if you talk to the other camp, this is kind of what the other folks are going to say, and this is why. So they can really understand that. So when they see the policy, they can see the full viewpoint of that and really make a good policy choice for the state of Montana. That's what they're there for. Help them do their job and do their job well. So that's kind of my viewpoint on those pieces.
Yeah, listen, acknowledge, ask questions even when they don't necessarily agree with you. You're probably not, if somebody is really dug in on a position, you're not going to turn them around with data. You're not going to turn them around with a single conversation. But it might be helpful to listen and to understand where they're coming from. And that takes listening and asking questions and not just waiting for them to finish talking, but actually listening to what they're saying and then thanking them and saying, hey, I get you. I understand what you're saying. I just want you to consider one thing. I have this job in statute. I'm trying to figure out how to do that. Can you help me with that?
And I can say just this last session, I was working with a legislator and he told me I was working with Satan. And so I was working on an issue, and unfortunately he had a very powerful position. He was on the committee that I had to work with all session. And you just have to remember that there's going to be issues that they're not going to ever agree with you on. But you know what? Today he's going to vote against me and I'm going to need his vote tomorrow and he'll vote with me. You just got to realize that that's just how it is. You don't take it personally. It's just data, baby. It's just data, baby.
Does that happen
understand
often? Does that happen often to you, Jean?
That
where you
I
have
work with
that sort of
Satan?
negative- Yeah, I mean, I've never had that happen. But.
In regards to,
Well, just that's pretty nasty. That's a pretty nasty thing. I mean, generally speaking, they're pretty cordial, civil conversations, even when people disagree. I don't want to scare people away from this whole.
yeah, no, I use that. Yeah, I use that because I think just to don't take things personally, because it isn't. Yeah, it is what it is, and it doesn't happen very often. And what you do is it's kind of building, again, that personal building of relationships, is that you just understand that particular person, and to them, it's a very important, critical issue for them. And you just understand that about them. And then tomorrow, they're a great, wonderful person on another issue. And we're all like that. We have some, it's just the core beliefs that they're coming from. And some they get really kind of grouchy and crabby on because they are so firmly rooted in that. And then in others, you're just perfectly aligned on, and you can go have a beer and talk about it. And that's that's what's awesome about the whole legislative session is you can go play one day together and the next day you're kind of, debating against each other. And that's just kind of the political component of that piece of it. But it sounds scary, but it really isn't scary to be in the midst of it because everyone kind of appreciates, and we should invite that diversity of views because that's what makes the better policy at the end. Because you want to go in there and you want to kind of get entangled into those different viewpoints because you can adjust the bill language or that policy debate a little bit. And by adjusting that, then it makes it a better bill or a better law at the end. You just don't want to let go of your voice through that process because it just makes it better at the end. And so you get entangled with that, and that's just part of that process.
The other advantage is if you remain civil, if you take that high road, that, as Jean just sort of said, it preserves your ability to go back and have that interaction again. And that leads me to my next question. I think it's going to be one of my final couple of questions for y'all. Things are so polarized these days over a lot of issues that often we'll know, you might know a legislator is just not going to vote for something, is not going to publicly come out and completely flip around where they were before. But what I always try to tell people is, like, even if you know that somebody disagrees with you, there is real value in them hearing you respectfully disagree with them. Because if the only thing that they're hearing from are the people who agree with them, they don't know that there are people who disagree. They're not going to take that into consideration. And when they're doing the calculus in their head about what they're going to do behind closed doors and deals that they're making with fellow legislators and how far they want to go, exactly how they want to write, that can have an impact when they're hearing from people who have that alternate viewpoint. Representative Kelker, can you talk about how much of this happens behind closed doors and how much that just hearing from people who might disagree may have a positive impact that you might never see or know about, but it could impact the final product that the legislature is producing?
I think what you described occurs very frequently. And the reason as you say, that you don't know about it because it's not public. I have some pretty close friendships with people who generally disagree with me on a lot of topics. But I do know that sometimes they will pick up on things that we've talked about and things that I have suggested, and it will be incorporated in their bill or their speech or whatever. And I have often sort of winked at someone who appears to be my, worst enemy and find out that, oh, not so much. That's not really the case. And the more we acknowledge that, the better we are. Jean is absolutely right. I've always tried to take the high road and continue to have relationships with fellow legislators, even though we come from very different points of view. Every once in a while, something very cool occurs and it surprises me, but that's the way human beings are. The worst thing to do is get really angry and let it show. And I think I've only done that once in public, and I hope I don't ever do it again. It's hard not to get angry about things that you care about very deeply. And especially when it involves what you think or what I think are very important issues. I, get wrapped around, and you just can't let that go too far. I think that people who are just starting to get to know legislators and they're working on those relationships just have to say to themselves to get started, well, I won't let this person get me too riled up. I'm going to do a lot of listening and try and figure out what, if anything, we have in common. and I'm going to be civil, and I'm going to leave the conversation with as nice an ending as possible. And the more you do that, the better you get communication with people who are, frankly, more difficult.
So I've neglected to ask for questions, which is not a good thing. So I want to open this up for questions from anybody on the call today.
I would say, and just add is that I'll just tell you frankly, some of the more painful losses that have happened in committees is when I've learned that I didn't get a vote because they didn't get a single constituent from their area contact them. And so they've heard from a lot of these mass communications, but not a single doctor contacted them. So I just would like to say a pain point is to not engage and to find out that that one person could have called and made a difference against the hundreds of mass emails that came in on that issue. If that one local physician would have made the email or call or text and gave that perspective, and it makes a huge difference for local constituents to reach out, and they do look for that local contact to come through.
So here's my last question, unless somebody else has one. There are some people and probably some policymakers who view public health entirely through the lens of COVID and the pandemic we've all been dealing with for the last 2 years, testing, contact tracing, shots, the stuff that masks, whatever the case may be. How can we make policymakers understand that public health is way more than that? And are there other issues out there other than COVID that we should be focusing on to propel that conversation? I'll leave you with the easy question, right?
You know, I think very much so. I mean, I think walking into the session, you know, we'll see what the top issues are, but, you know, most certainly it's kind of interesting. I went into the finance committee last week. The finance committee, they got a work group on suicide. Who would have thought? That's where I would go. Yeah, we have two huge studies, adult mental health and children's mental health. We've got record number of studies showing rises in regards to use of opiates and deaths around that. That's all the space that you guys play in. That's what I would be talking about.
And if you have a community health assessment, it probably has behavioral health data indicators and information coming from their constituents that you could pass off to them. I completely agree. Even before the pandemic, I remember being in Helena thinking that behavioral health seemed to be the one area where there seemed to be actual bipartisanship in a lot of things. Or maybe some things, maybe a lot is a strong term, but there seemed to be some, and I think that might still be the case.
Absolutely. And I think everyone has and knows someone that's been touched by those issues.
It's a way to relate to and connect with legislators, because goodness knows everybody has a family member who struggled with mental illness. Everybody probably has a family member who has such struggled with dependency of one kind or another. And talking about those things in a human way and opening the door, hey, maybe we should start thinking about helping people before they get into crisis. That's a head nodder. That's what I mean when talking about getting people's heads nodding. That can start right away, and probably should start right away.
And I know that, and I think that's something that you can jump into with like that finance group that has that work group. And we have Dr. Greg Kolsman kind of working with us, and I sat down to talk with him, and he was showing me, and this is the pyramid that you guys probably are all familiar with, and Gene's less educated. And he goes, you know, you're always up here, Gene. We're always up here with that suicide plan on education. And
see, we're getting to you, Gene.
Down here, right? You're getting to me. And I know that, and I was sharing with them, you know, how physicians by occupation, physicians are the #1 occupation that is, dying by suicide. And we know what we can do to lower that number. But we aren't working on that. We're not working on the system transformation that needs to happen at hospitals. And so why aren't we getting down there to system transformation for veterinarians and farmers? Why are we always up here? And so those are the conversations I think that we're interested in having transformational pieces rather than continuing to be at the top of that pyramid. So I know Greg's digging into those kind of informational pieces, but I think that's your space. So I think
The bottom of the pyramid, yep, the base of the pyramid, that prevention area. I would echo that, and it's our chance to have conversations that matter. And I would say to people like, look, this next legislative session, it's likely to be fairly rough and tumble for public health again. Got to keep your chin up. You got to take the high road, and you got to look for ways to have conversations such as behavioral health. And there's probably others that get heads nodding and open eyes that, hey, maybe public health is more than just contact tracing and masks.
I would like to add that I think a lot of people in Montana have been very unhappy during the COVID period for a whole variety of reasons, and it's not something that we can ignore, that people have been harmed in various ways. And again, that's an area where we have to listen to where people are. I think there is a tendency to do a lot of blaming. Oh, if only this hadn't happened, or if this hadn't been said, or whatever. And none of us were ready for COVID. And many families have lost members because of that illness. And so it's going to take a while for just average people to get back to what they seem to have as normal. So I think you're right in saying that in the legislature, we should be looking at what we can do and what will make the most difference. And behavioral health is certainly top on the list. It's been on top on the list for me for a long time. And we may find that there's more people who agree on that topic than many others. So that's a great place to go, and we have plenty to do.
Thank you both so much. Dorinda, thank you too for taking the impromptu helper role. I really appreciate it. Jean and Kathy, I really appreciate it. We got a little bit of more housekeeping. You're welcome to stick around if you need to, but you're also certainly, I know you're both pretty busy, so you're welcome to take off too. But thank you. I really appreciate you being here.
Thanks. I just say that we just got done doing another strategic plan, re-looked at it. Public health is on it, got 4 objectives. You're on it. So give me a call.
And just so you know, we'll be next week, we'll be talking about our public health associations and how they can relate. We'll be working with Lisa Dworak from Confluence Public Health Alliance. And so that will be front and center. And you're not doing this all alone. We have associations, not just public health associations, but other partner organizations that we're working with. You can fit into and learn this work through them, especially during a legislative session. Thank you both.
Thank you for having me.
Bye-bye.
Thank you. So we have just 5 minutes left of the class. Let me share my screen one more time here. My goal here is I have a little bit of preparation that I want you to go through for the next class. My goal here is not to, I know you're all super busy, but I think these are activities that I think will help you down the road. They're meant to be something you can do in 20 or 30 minutes. I'm going to send you an email right after this class with a couple of things, including a reiteration of what's on this slide here. But I'm gonna, if you go to Montana, www.ledge.mt.gov, you'll find the Montana legislature's website. Some people will call that the law's website. On that website, let me stop the share here and start it again. On that website, you will see, as you can see, is that scrolling during the, you'll get to this website here, you can see there's some high level stuff here. You can see the Montana code annotated, but you can also go in here and do a bill search. You can look up legislators. You can look up the session pages, and I'm going to send you a guide for creating something called a preference list, where you can, during the 2023 legislative session, you can go in and identify legislation that you want to follow. You can get email updates on where that legislation is. You can call that legislation to the attention of colleagues, including the public health associations. So this should take you, 20, 30 minutes. And then what I want you to do is, use the time to figure out who your local legislators are, get on that laws page, sign up, create a preference list, even if they're going to have to do it again later. Explore that laws page. I'll send you an email with that and a sort of a helper document I put together to help you learn how to create that preference list, because those are really powerful tools. You don't have to keep all this in your own records. That laws list, that you can create that preference list, and HB 121. Oh, it'll send you a note when there's a hearing scheduled, or when some action has happened, and it plugs into the work that our public health associations are doing, whether that's the Association of Montana Public Health Officials, or the Montana Public Health Association, or the Montana Environmental Health Association. It's just a valuable resource and tool. Next week we're going to come back. We're going to talk about that work. So I'm going to call on you just to talk about questions you may have. I may have a local, be able to have a local policymaker, a member of the Bozeman City Commission on that call. And then we're going to hand it over to Lisa Dorak from Confluence, who's going to walk us through how our public health associations work and how we typically plug into the legislative session as a public health entity and organizationally during the legislative session. So look out for that email. I'll send it as a response to the invite that we had, that you have to come to this meeting. I will see you a week from today. If you could just take the time to do that, and maybe next time come in, turn on your cameras, and we'll have a conversation at the outset about how that went, questions that you might have, troubleshooting that we might get to. We're going to get more into the tools of how we do this work. Any questions before we take off? It is 1:59.
Matt, are you going to share your slides as well?
Yeah, I'm happy to do that. And Amy, how does this work? So the participants can also get a recording of the session as well?
Correct. So after next week's session, we'll be editing the recordings from today and from next week, and then we will be putting together a resource page with the slides and any other additional handouts that might be coming through, and then we will send it out to everyone who's registered, and that information will be available like about 30 days, 45 days after all of that information is sent out.
I got your comment. Thank you, Amy and Kim, both for your comments. I really appreciate it. And I really appreciate all your time. And mostly I appreciate your hard work through the last couple of years. I know firsthand how hard it's been. And I know that what it means to have people say thank you and mean it. And I really mean it. So thank you. And have a great day. And we'll see you next week.
Yeah. Thank you, everyone. See you later.